Hi, you guys. Welcome back for our daily practice questions. It is day 220, and as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient-by-patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So with that being said, let's get into question number 1 for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my NP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description as well, and it houses all of the resources that I offer. But if you're looking for the easiest way to find how to contact me with telephone number, the number that you can text, email, website, and reviews from other students, you can simply go to Google, and this is what you see here. Just search The Nursing Studio, and it'll take you to everything related to that. This is the easiest thing that I recommend when I'm asked, where's this, where's that? This is the easiest location for everything. All right, y'all, let's get into the questions. Question number 1. A 66-year-old man with a 40-pack year smoking history presents with chronic cough and occasional shortness of breath with strenuous activity. Spirometry shows FEV1 is 85%. What is the most appropriate initial treatment? Is it A, an inhaled corticosteroid daily? Is it B, a short-acting bronchodilator or SAMA as needed? Is it C, a LABA daily? Or is it D, oral corticosteroids? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. So here the stem of the question states, what is the most appropriate initial treatment? And I always say, if they're asking for a treatment, look to see if they provided you with a diagnosis. If they have not, you have to run it back a step further and look at the assessment findings. How are they presenting? What are the signs and symptoms? Because we got to know what it is to be able to treat it, right? So here, also, we're looking for treatment, but we're looking for the initial treatment. So they have not provided us with a diagnosis, but let's see what's going on. So based off of the assessment, we have a 66-year-old man. He has a 40-pack year smoking history, chronic cough, occasional shortness of breath with strenuous activity, and his FEV1 is 85%. This is a diagnosis of COPD, right? Now, with an FEV1 of 85%, remember your COPD stages. Remember there's 4 gold stages, right? And I'm telling y'all the way to approach COPD for how the boards are currently testing. I know when there are multiple things that are currently out, but that might not be in alignment with what is currently on the test. So, know your 4 gold stages for COPD, right? So with an FEV1 of 85%, that is still stage 1. So we want to make sure you have something short acting on board. So it can be a SABA or a SAMA. They just need something that will serve as their rescue inhaler, and it will be as needed, right? So B is your best answer. Because remember, a FEV1 of 80% and greater puts you in stage 1. All right, question number 2. A 72-year-old woman with COPD reports worsening dyspnea on exertion and uses her rescue inhaler daily. Spirometry shows an FEV1 is 60%. What is the preferred next step in treatment? Is it A, continue SABA alone? B, start an ICS and LABA combination inhaler? C, add a LABA or LAMA? Or D, start oral theophylline? Take a moment and tell me what you got in the comments, y'all. All right, stem of the question here states, what is the preferred next step in treatment? So again, they're asking for a treatment. Run it back and see if they gave you a diagnosis, right? And they have in this scenario, so we have COPD, right? So let's see what we have going on. And it's saying the preferred next step. So if they're telling you next, you need to identify what we're currently doing so you can know what you need to progress to, right? So COPD, she's having worsening symptoms. She uses her rescue inhaler daily. Spirometry is 60%. So 60% of a FEV1 spirometry, that falls into stage 2. Remember, stage 2 FEV1 runs from 50% to 30%. Y'all, if y'all struggle with COPD, go look at my COPD videos. Just click playlist at the top of my channel and scroll down to the COPD section. It'll take you directly to the videos on COPD where I walk you through the chart that I break down in my book. So you'll be able to see that. So I'm not spending so much time doing that with a question. But remember, we're looking at the FEV1. Although we do pay attention to the symptoms, COPD is chronic. So it's not going to get better. It's only going to stabilize or worsen, right, as we progress. So we want to follow that FEV1 to give us a clear indicator of where they're falling in the COPD stages. So stage 1, like question number 1, their FEV1 was 85%. So that put them in stage 1 because it was greater than 80, right? Now, stage 2, the FEV1 can fall anywhere from 50%, from 80% to 50%, right? So that's why 60 falls in that range, puts us in stage 2. So now you need to ask yourself, what do we need to do? They're already on a rescue inhaler, so that means they're already on the short acting. So now we want to add a daily long acting. It can be a LABA or LAMA with COPD. Okay? And if you're running into these questions, I always say stay with the drug class. So if they give you a SABA name like albuterol on the exam, and then you're adding in a LABA and they're looking for a name, I say stick with the LABA and go with like salmeterol, you know? If they give you a SAMA, go with the LAMA. But you can alternate with COPD, but for board's purposes, I'm telling you to follow that track. But short acting, then add you a long acting. And although there are additional factors that are included in each stage, we're strictly talking medications right here. But go check out those videos where I walk you through each of those. And lastly, question number 3, a 69-year-old male with a history of COPD has an FEV1 of 38% and frequent exacerbations. He is currently on a SAMA PRN and a LAMA daily. What is the most appropriate next step? Is it A, add oral corticosteroids daily, B, add an inhaled corticosteroid daily, C, refer for a lung transplant, or D, stop bronchodilators and switch to nebulizers only? Take a moment and tell me what you got, y'all. All right, stem of the question here. What is the most appropriate next step? So this is still treatment, and we see that there's a diagnosis. They have COPD, but we're looking to see what we need to do next. The FEV1 is 38%. Y'all, this is stage 3. Stage 3 FEV1 is anywhere from 50 to 30%, and then stage 4 is anything less than 30%. Now, in stage 3, the medication we're adding is an ICS. We already have a short acting on board, as you see here, PRN, the rescue inhaler. Then we have a long acting daily. So now in stage 3, we want to add in our ICS. So B is your best answer. Now, y'all, I don't want to overwhelm you. Go look at the COPD video with the chart and everything while I walk you through. But I'm going to try to explain this briefly because I don't want you to think that these are only medicines and things that we do, right? So with COPD, stage 1, we have an FEV1 of 80% or greater. Sometimes it may list it as 79% or greater, right? But so we're going to stick with our 80% or greater. So you want a short acting on board, PRN. It could be a SABA or SAMA. And you're going to give them the flu vaccine if it's flu season. This is a chronic respiratory disease. We want to make sure you're covered if it's flu season. Remember, flu season runs from October to March. If they give you these dates, they're trying to let you know it's flu season, okay? All right, stage 2. The FEV1 runs from that 80% to 50%. We drop down 30, right? So 80 to 50. We're still going to keep our short acting on board. We never drop any medicines. We continue to add. It's chronic, so you're going to add on. So short acting as needed, right? Flu vaccine if it's flu season. But now we add in our long acting, right? That's the medication you're going to add. That's what we did on question number 2 here. But also in stage 2, we refer them to pulmonary rehab. Now, the way my Brittany's Brilliance tells you to remember that is pulmonary rehab is 2 words, and we initiate that in stage 2. All right, now follow me. Stage 3, we are now running from 50% to 30%, right? So we still keep our short acting on board. We still keep our long acting on board. If it's flu season, we're still going to give the flu vaccine. We still refer out to pulmonary rehab. But now the medication we're adding is an ICS, inhaled corticosteroid. I always say, Brittany's Brilliance, remember, ICS is 3 letters, and we implement that in stage 3. And then stage 4, the FEV1 is less than 30%. All of the same things that we have done throughout, we continue. And now you're going to add in oxygen therapy, but also, pulmonary is going to be managing this, because if it's this severe, this is not something that we are controlling solely in primary care, right? So just know your stages and work your way through in that fashion. All right, y'all. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the Nursing Studio. You can give us a call, shoot us a text message, shoot us an email. And as I mentioned previously, you can either Google the Nursing Studio or go directly to the link to my website that is linked in the bio, as well as the description of this video. All right, y'all. Y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.